Welcome to the deep dive. Today we're getting into something pretty important in pet health. Hypercalcemia in dogs and cats. It's like this hidden issue, where calcium levels just get too high.
Yeah, and we've got some really solid sources today. They give us a detailed look at what's quite a complex condition in our pets.
It really is complex. So our mission here is to kind of unpack all that for you. We want to break down what hypercalcemia actually is, why it might happen, and, what it could mean for your dog or cat.
Medical stuff can sound daunting, absolutely.
For sure. But we'll aim for clarity, focus on the key things you need to know. Okay, let's dive in.
All right, so the basics. Hypercalcemia is literally just too much calcium in the blood. Simple as that. Now, the specifics. Our sources say for dogs, we're looking at total calcium over about 11.5 milligrams per deciliter.
Okay.
Or, and this is important, ionized calcium above 1.45 millimoles per liter. For cats, it's a little lower, total over 10.5, and ionized over 1.4.
And you mentioned ionized calcium is important. The sources really stress that, right? Confirming with ionized calcium seems key.
Absolutely crucial. Because the total calcium, even with those correction formulas people use sometimes, it doesn't always tell you the real story about the active ionized calcium.
The active form the body actually uses? Makes sense.
Exactly. That ionized level gives us the physiologically relevant picture. So why does this happen? It gets into the body's really intricate calcium control system.
Okay.
It's this delicate dance, really, between parathyroid hormone, PTH, and vitamin D.
PTH and vitamin D, they're the main players.
They really are. PTH basically tells the body to raise calcium levels, and vitamin D helps absorb it. They work together, influencing the gut, the bones where calcium is stored,
Like a calcium bank.
Right, a bank.
Yeah.
And the kidneys, which control how much calcium leaves in the urine, and even the parathyroid glands themselves, if any part of that system goes haywire.
Or if something else interferes, like cancer cells.
Precisely. If cancer cells start putting out substances that mess with calcium, or if that communication network breaks down, boom, hypercalcemia.
It's like a whole cascade effect. So when the calcium does get too high, what does that actually do to the pet's body? What systems are affected?
It can hit quite a few places. Cardiovascularly, you might see high blood pressure, hypertension, or changes in heart function.
Okay.
In the gut, high calcium can slow down the smooth muscle, potentially messing with digestion.
And muscles generally.
Yeah, neuromuscular effects too. Just sort of depress muscle contractility, leading to weakness.
That sounds pretty widespread. And I know you mentioned the kidneys earlier. They seem particularly vulnerable.
Extremely vulnerable.
Yeah.
High calcium is actually toxic to the kidney tubules. That's often why you see the PUPD, the increased drinking and urination. It's one of the classic signs.
Okay. So the body's trying to flush it out, but it's damaging the kidneys in the process.
Kind of, yeah. And if it goes on long enough, it can unfortunately lead to actual renal failure. Plus, it increases the risk of calcium-based kidney or bladder stones uroliths.
Wow. Okay. That's serious. So who gets this? Dogs, cats? Any particular types?
Both dogs and cats, definitely. But the sources do flag a couple of breeds. Keeshonds seem more prone to primary hyperparathyroidism.
Keeshonds. Okay.
And Siamese cats also pop up as having a predisposition for that same condition.
Interesting. Now, the signs, you mentioned increased drinking and peeing, but you also said it can be subtle.
That's a huge point. A lot of animals, especially early on, might show absolutely no signs. Zero. Zilch.
Really?
Yeah. When you do get signs, though, historically in dogs, that PED is probably the most common thing owners notice. In cats, it's often more about lethargy, just being sluggish, not themselves.
Okay, lethargy in cats. What else might you see?
Well, you could see things like poor appetite, maybe vomiting, constipation, general weakness. If it gets really severe or chronic, you might even see neurological signs like being really out of it, stupor, even coma in extreme cases.
That sounds awful.
It can be. And don't forget those urinary stones, if they form, you might see signs like straining to pee, going more often, that kind of thing.
And what about at the vet's office? What might they find on a physical exam?
It really depends on the underlying cause. If it's lymphoma, for example, the vet might feel enlarged lymph nodes or maybe an enlarged spleen or liver in the abdomen.
Oh.
But for something like primary hyperparathyroidism in dogs, the exam can be totally normal, nothing obvious. In cats with that condition, sometimes you might be able to feel a little nodule in the neck, a parathyroid adenoma, but it can be tricky to tell apart from the thyroid gland.
So no obvious signs doesn't mean it's not there. And findings can point towards why it's happening. Let's talk causes. The list seems pretty long.
It is quite long. Cancer neoplasia is a big one. Lymphoma is the most common cause in dogs, though less so in cats.
Right.
Then there's anal sac adenocarcinoma in dogs. Nasty one. Multiple myeloma, lymphocytic leukemia, bone mets.
Cancer that spread to the bones.
Exactly. Various carcinomas. And in cats, fibrosarcoma is mentioned too.
That's a lot of cancer links. What
Right.
else causes high calcium?
Well, primary hyperparathyroidism itself, where the parathyroid glands just go into overdrive. That's a key one. Kidney failure too, both acute and chronic, though the reasons there can be complicated.
Okay.
Then you've got granulomatous diseases, certain inflammatory conditions, and hypoadrenocorticism, Addison's disease.
Addison's. How does that cause high calcium?
The exact mechanism isn't always crystal clear, but it's a known association. It's one of the things to check for.
Gotcha. What about external factors like diet or toxins?
Definitely. Vitamin D intoxication is on the list.
Mm.
Could be from eating certain plants or too much vitamin D in the diet or supplements.
Mm.
Thankfully, those super high-dose vitamin D rodenticides aren't really marketed anymore in the U.S.
That's good.
Also, osteolytic diseases, things that cause bone breakdown, aluminum toxicity, less common. And then in cats, there's this thing called idiopathic hypercalcemia.
Idiopathic meaning? We don't know why.
Pretty much. After all the tests, sometimes you just can't pinpoint the cause in cats. It's frustrating.
Wow. So, given all those causes, are there specific risk factors that make hypercalcemia more likely?
Yeah. Linking back to the causes.
Yeah.
Being a Keyshawn, as we said.
Right.
Already having kidney failure.
Right.
Obviously having cancer. And then things owners might do, giving calcium supplements or certain phosphate binders used for kidney disease that contain calcium. Using calcitriol, which is a form of vitamin D.
Makes sense. Adding more calcium or the stuff that helps absorb it. Okay, so let's say a vet suspects hypercalcemia. How do they go about figuring things out? What's the diagnostic plan?
It starts with a really thorough history. Asking you, the owner, about potential vitamin D exposure, maybe getting into houseplants or supplements, any steroid use, any history of illness that comes and goes. That waxing and waning pattern could suggest Addison's.
Okay, the history is key, then the physical.
Absolutely. Careful check of lymph nodes, a rectal exam, super important for finding those anal sac tumors in dogs, feeling the abdomen carefully, checking hydration, feeling the kidneys, asking about urination habits, all crucial clues.
And then the lab work. Blood tests, urine tests. What are they looking for?
Blood work is non-negotiable. First, measure the calcium. Total calcium, yes, but ideally, getting that ionized calcium level is best. Because remember, total can be tricky.
Right, the ionized is the active stuff.
Exactly. Then they look at kidney values, azotemia, waste products building up, and urine concentration isostenuria to see how well the kidneys are working. Phosphorus level is another piece of the puzzle.
How does phosphorus help?
Well, it's interpreted with the calcium and kidney values. For instance, lowish phosphorus with high calcium might point towards primary hyperparathyroidism or some cancers. High phosphorus without kidney failure might suggest something else, like vitamin D toxicity. It gets complicated if there's already kidney disease, though.
Okay. Anything else in the basic blood work?
Yeah, they'll look for electrolyte changes like high potassium, low sodium, another hint towards Addison's, maybe high protein levels, globulins, suggesting multiple myeloma, or low cell counts, hinting at bone marrow issues.
So much information in there. And then the specific hormone test, you mentioned PTH.
Right. If ionized calcium is confirmed high, measuring PTH is often the next step. If PTH is high or even high normal in the face of high calcium, that strongly suggests primary hyperparathyroidism. If PTH is low, suppressed, then cancer becomes much more likely.
Okay, that makes sense. The body's trying to shut down PTH production because calcium is already high, unless the parathyroid itself is the problem.
Precisely. And then there's PTH-related peptide, PTH-rp. That's the substance some cancers make that acts like PTH. Measuring that can be really useful for diagnosing cancer-related hypercalcemia. Vitamin D assays exist, but they're not always easy to get run.
Got it. So blood tests point the way. What about seeing inside? Imaging.
Imaging is super important.
Yeah.
X-rays first, maybe. Check kidney size and shape. Look for stones, any obvious bone destruction from cancer. Maybe even find hidden tumors in the chest or abdomen.
And ultrasound.
Ultrasound gives a closer look. Great for kidney detail, finding enlarged lymph nodes in the belly, sometimes spotting those little parathyroid tumors in the neck, and confirming stones.
Okay. And sometimes you need more direct samples, like needles or biopsies.
Yeah, depending on what you find. Enlarged lymph node, fine needle aspirate to check for lymphoma cells, worried about blood cancer. Maybe a bone marrow aspirate, Suspect Addison's, you do an ACTH stimulation test to check the adrenal glands.
Right. So you work through the diagnostics, find the cause, or at least confirm the hypercalcemia. What about treatment? Sounds like it needs prompt attention.
It absolutely does, especially if the calcium is significantly high. It's often treated as a medical emergency requiring hospitalization. The first goal is usually just to get the calcium down safely.
How do they do that? Fluids.
Fluids are key. Intravenous fluids, specifically normal saline, 0.9% sodium chloride. It helps rehydrate the pet and encourages the kidneys to flush out calcium. Crucially, avoiding fluids that contain calcium themselves, like lactated ringers.
Okay, saline flush. What about drugs?
Diuretics, like furosemide, can help increase calcium excretion by the kidneys, but only after the pet is properly rehydrated. Corticosteroids can be very effective for some causes, like lymphoma or Addison's.
But didn't you say be careful with steroids?
Yes, absolutely. You generally don't want to give steroids before you have a diagnosis, especially if lymphoma is suspected, because it can make diagnosis harder. And definitely not before an ACTH stim test if you suspect Addison's. Also, avoid thiazide diuretics. They actually reduce calcium excretion.
Good points. Are there other, maybe stronger drugs for really tough cases?
There are. Things like sodium bicarbonate are sometimes used. Mithramycin can lower calcium fast, but has potential toxicity, so it's reserved for emergencies. Calcitonin can be useful, especially for vitamin D toxicity. And bisphosphonates, like pimidronate, work by stopping bone breakdown and can be very effective.
Okay, lots of options depending on the situation. And once treatment starts, what needs careful watching? Monitoring.
Constant monitoring. Checking serum calcium frequently, like every 12 hours. Ideally ionized calcium. Watching kidney function closely, blood tests, urine sediment for any signs of ongoing damage like casts.
Okay.
Tracking urine output is vital, especially if kidney failure is a concern. And just basic hydration status, body weight, maybe central venous pressure in critical cases, checking for edema, making sure the fluid therapy is right.
Makes sense. Keep a very close eye on everything. What are the biggest risks if this isn't managed well, or if it's really severe? Long-term problems.
The two big ones are irreversible kidney damage leading to chronic kidney failure down the road, and soft tissue mineralization, calcium depositing where it shouldn't, like the kidneys, stomach, lungs, heart. That can cause significant organ dysfunction.
So definitely something to take seriously. Okay, to wrap up our deep dive today, what's the main takeaway for listeners about hypercalcemia?
I think the key is recognizing it's a complex sign with many potential underlying causes, some quite serious. Getting to the bottom of why the calcium is high is critical, and early detection can make a big difference.
Absolutely. And for you listening, if you notice any of those signs we discussed, your pet drinking or peeing way more than usual, seeming unusually tired, off their food, any of those things, please talk to your vet. Don't wait.
They're the ones who can run the tests, figure out if hypercalcemia is the issue, and start that crucial investigation into the cause.
Right. And maybe a final thought to leave you with. Think about those subtle changes in your pet, that extra trip to the water bowl being a little less playful.
Yeah, it's easy to overlook small things, isn't it? But as we've discussed, sometimes those little shifts can be clues to something bigger going on underneath. Being observant, being proactive. It really is key to catching problems early.